Derby. I'm a nursing student from Augusta University. Can you tell me your name and date of birth?
Amanda Derby, April 28th, 1999.
Okay. Well, I'm here today to do an assessment of your neurological and your musculoskeletal systems. Are you having any pain, Amanda?
No.
Okay, great. Well, the first thing I'm going to do is I'm going to assess your cranial nerves. I'll just ask you to take off your glasses, please, and I'll put them right over here. And I'll be assessing your 12 cranial nerves. The first nerve I'm going to assess, you can just close your eyes for me. I'm going to be assessing your olfactory nerve. That's your first cranial nerve. Let's go ahead and make sure that your nares are patent. Can you breathe in for me? Okay, good. And how about on the other side? Okay, great. They sound like they're patent. Okay, you can close your eyes.
Zero.
Okay, great. Okay, you can open your eyes now. And the second cranial nerve is your optic nerve, and that will be a test of your visual acuity. I have a Snellen eye chart over here, and if you were to be tested and your vision became 20/40, that means that you can see at 20 feet what someone with perfect vision could see at 40 feet. Do you know what your vision is without your eyeglasses?
No.
With your glasses, is your vision 20/20?
Yes.
That means that you can see with your glasses at 20 feet what someone with perfect vision could see at 20 feet, and that's corrected with your glasses. I'm going to be checking your pupillary reflexes, your pupillary response, and I'll also be checking your peripheral vision. Okay. When I wiggle my fingers and bring them close to your side, the side of your face, let me know when you can see my fingers in your peripheral vision. Okay.
Yes.
Okay.
Yes.
Okay.
Yes. Yes.
Okay. And I'll also go ahead and take a look at your pupils. This is checking cranial nerve 3, 4, and 6 for your pupillary response. And that check that I did with my fingers was for your peripheral vision. Okay. Okay. Brisk pupillary response. Very good. And now I'll be checking your 6 cardinal fields of vision with my pen. So just what I'd like you to do is just to follow the pen with your eyes only. Okay? Okay, very good. And that was to check your 3, 4, and 6. And now let's check your trigeminal nerve. And this is going to be checking your facial sensation. All right. This is going to be a sharp touch, and this is going to be a dull touch. Okay? And this is going to be a soft touch. And when I touch your face, just let me know what that feels like. If it's sharp, if it's dull, or if it's soft. Sharp. Sharp. Dull. Dull. Okay. And then one more. Soft. Soft. Okay, great. I'm also going to be checking your corneal reflex. Just look straight ahead. I'm going to approach your eye with this cotton. She blinked. She blinked. Okay, great. All right, now I'm going to ask you to look at me. We're going to be doing your, checking your facial nerve. Raise your eyebrows. Close your eyes. Smile, puff out your cheeks, frown, show your teeth, wrinkle your forehead. Facial nerve is intact. Okay. Let's go ahead and check your acoustic nerve. I'm going to activate my tuning fork, and I'm going to put that tuning fork on the middle of your head. And when you hear the sound, you're going to hear like a vibrating sound. Let me know if you hear the vibrating sound better in your right ear, better in your left ear, or equally on both sides, okay?
Right.
You hear it better on the right side, so the sound is lateralizing to your right ear, so there may be some conductive hearing loss on your right ear. Okay, let's also do another test. It's called the Rhine test to assess for air conduction versus bone conduction of sound. So I'm going to activate my tuning fork. I'm going to place it over here on your mastoid process, and you'll hear a vibrating sound. When you no longer hear the vibrating sound, I'm going to turn the tuning fork towards your ear, and then you can let me know when you no longer hear the sound turning towards your ear. Okay. Okay, so the sound actually seemed to have been longer through bone conduction, so there may be some conductive hearing loss there. We'll try it on the other side. Okay, we'll do this. Okay, so it was longer. All right then. So that was your acoustic nerve. Let's check your glossopharyngeal. So she's not drooling. So Amanda, swallow for me. All right, and I see no drooling, and she's able to swallow. So I know that she's got a good gag reflex. Okay, open your mouth. The uvula is midline, say ah. Pharynx raises and it's symmetrical. Let's see your tongue. You move your tongue from side to side, please. Okay, it's moving equally and symmetrically on both sides. There are no fasciculations. Okay, great. And then let's also check your shoulder strength for your spinal accessory nerve. I'm going to push down on your shoulders. Do not let me push your shoulders down. Okay, and then against your face. Don't let me push your face. Good strength, bilaterally symmetrical. All right. And then the 12th cranial nerve is your hypoglossal. Her speech has been articulate. Her tongue, when she moved, was midline. There were no fasciculations. There was no atrophy to the tongue. There was no tics noted. Okay, great. So that concludes your cranial nerve assessment, Amanda. And now I'm going to check your joints. The first joint I'm going to check is your neck. Go ahead and turn your neck from side to side. And raise your neck up, and then put your neck on your chest. Okay, great. So that was smooth and even. I did not hear any crepitus with her neck joints. Shoulders, go ahead and raise your arm, and then put your arm down, and then across your body. I heard no crepitus. Any pain, Amanda?
Mm-mm.
Okay, and let's try your other arm, please. Great, and then down, and then across your arm. There was no crepitus heard, and no impingement or shortening of that extremity. Okay, let's go ahead now and assess your elbow joint. Go ahead and bend your arm at your elbow. Okay, and then your other arm. Okay. I see no deformities. I hear no crepitus. Let's check your wrists. Go ahead, Amanda, and turn your wrists this way, inward and outward, okay, and then raise your wrists up and down, up and down. Okay, good. And there's no crepitus, any pain, no swelling. I don't see any redness on the joint of the wrist, and there was no crepitus heard. With your fingers, just wiggle your fingers for me, and go like this and wiggle your fingers. Okay, and then rapidly touch your thumb with all four of your other fingers in alternating movements. Okay, great, very good. And now I'm going to actually check your hip joint when you're lying down on the bed, so I can check your hip joint at that time. I'm sorry, on the couch. I'm not going to check right now because I don't want you to have to move positions. Okay, let's go ahead and check your knee. So go ahead and just bend out your knee, your leg at the knee. Okay, any crepitus, any shortening of the extremity? Okay, and then your other. Okay, great. Let's check your ankle. And what I'd like you to do is just to turn your ankle inward in a circular movement. I hear no crepitus, I see no swelling, and then the other way. Okay, and let's assess your right. Okay, good. And then the other way. And now your toes. Wiggle your toes for me. Okay, and bend your toes up and then down. There is no crepitus heard. I see no swelling to the toes. I see no deformities. Okay, great. All right, let's go ahead now, Amanda, and what I'd like you to do is to rapidly actually let's do your muscle assessment first of your muscles and see. I'm going to check your your biceps musculature and see how strong your muscles are. So just make a muscle like this, and then I'm going to pull your bicep towards me. Don't let me pull your arm. Nice and strong. Okay, other side. This is checking your muscle strength of your biceps. Okay, great. Let's check your triceps musculature. Same thing, you can just bend your arms, and I'm going to push against your arm. Don't let me push. Okay, great. Got some strong muscles there. Okay, great, very good. Okay, you can put your arms down. I'm just going to assess your quadriceps. Okay, there is no atrophy. They're nice and firm. They're bilaterally symmetrical. Let's check your leg musculature. Okay, any pain?
No.
And the musculature feels nice and strong and good musculature. Your reflexes were the next thing that I'm going to check. Will be the next thing I'm going to check. I'm going to start off with checking your deep tendon reflex in your biceps. Okay. All right. So put your arm down here like so. Okay, that's one. Okay. And let's check your triceps. Deep tendon reflex. Okay, let's check the other. Okay, and let's check your brachioradialis. Okay, and we'll check your patellar. Okay, and we'll check your other. Okay, and we'll check your Achilles. This is your Achilles deep tendon reflex. With the back of your heel. Okay, we'll check the other. Okay, good. And that was your reflex assessment. So now let's also do another assessment of rapid alternating movements. So what I'd like you to do is to tap your hands on your hips, on your quadriceps right here, rapidly alternating like so. Check your coordination. Very good, excellent. And now what I'd also like you to do, Amanda, is to use your left heel and to run your left heel down your right shin. Okay? And now I'd like you to do the same on the other leg. Okay, great. And now I'd like you to, I'm going to hold your your foot in my hand. I'd like you to tap your left foot on my hand as fast as you can. Okay, good. And we'll try the other side for your coordination. Good strength, and there's no clonus. Okay, great. Now what I'd like to do, Amanda, is to use a series of objects that I have that are familiar objects to test for stereogenesis. Okay? And also, too, I'd like to assess, do you use the computer a lot? Do you spend time on the computer? So I'd like to check if there's any carpal tunnel issues with your, in your carpal tunnel area, if you have a carpal tunnel syndrome. First of all, let's check for stereogenesis. Close your eyes for me, please. Okay, and I'm going to put an object in your palm, and you tell me what that object is.
A pen.
Okay, great. And then we'll try this object.
A pen.
Good. Okay, and then we'll try with your other hand. All right.
A Q-tip.
Good. That's accurate. And then one more.
A paper clip.
Okay, very good. Okay, you can open your eyes, Amanda. I'm also going to be checking your sensation and on your arms and on your legs. And this is a sharp touch. And this is a dull touch. And this is a soft touch. Okay, so you can let me know when I touch you. Close your eyes, please. Okay.
Sharp.
Sorry, I'm sorry. I didn't want to hurt you.
Sharp.
Okay, great.
Dull.
Good.
Dull.
Okay, great. I'm going to try on your quadriceps. Okay.
Dull. Dull.
Okay.
Sharp. Sharp.
Okay, great. So your sensation is good on both sides. Okay. So let's go ahead and have you stand up, Amanda, and turn your back towards me. Just going to assess your spine. Okay, great. And your posture is erect. I see no gross deformities on your body. Go ahead and, Amanda, what I'd like you to do is to, here's your glasses so that you can see well. I'm going to have you walk to the couch, just like you normally would walk. Okay? When you come back to me, Amanda, I'd like you to walk on your tippy toes. Okay? And when you walk back to the couch, I'd like you to walk on your heel. Her gait is steady. She's not swaying from side to side. There is no ataxia. Okay, great. And now when you walk back towards me, Amanda, I'd like you to walk heel to toe. We call it tandem walking. I'd like to see your balance. Okay, her balance is steady and erect posture. Okay, great. Now let's go through a series of exercises, Amanda. What I'd like you to do is to hop on one foot. Okay, and then on the other. Okay, great. And what I'd like you to do now is to bend one of your knees, so you're standing on one foot, and do a knee bend. Okay, good. And then on the other side. Very good. Good balance, good posture. She's bilaterally symmetric. She did not fall or sway or any of those things. Okay, now we're going to test your Romberg's assessment. That's to see about your balance. Put your feet together. Okay, and then close your eyes and just stand with your eyes closed there for just a couple minutes or a little bit less. But okay, she's not swaying. There's no falling or any issues there with her balance. Okay, you can open your eyes, Amanda. Okay, and then what I'd like you to do is to lie down on the couch. Okay, and I'm going to raise your leg. So I'm going to raise your leg up. You let me know if there's any pain that you're feeling when I raise your leg to 30 to 70 degrees. Okay? I'm also at this time going to be checking your hip and also to your hamstrings. Okay? Okay. Any pain?
No.
Okay. Now I'm going to check your hip. Any pain when I do that internal rotation or external rotation?
No.
Okay. And I heard no crepitus and there was no deformity noted. Okay, I'm going to flex your toes. Any pain?
No.
Checking your hamstring. Okay. And then we'll go ahead and raise your leg. Any pain?
No.
Okay, I'm going to rotate your leg inward and then out. Any pain, Amanda?
No.
Okay, great. And then we'll check your hamstrings. Any pain there?
No.
Okay, good job. All right, Amanda, go ahead and have a seat over here on the chair. We're almost done. The last thing I'd like to do is test when I was thinking about your hearing test, I just thought that there's one other test to check to see how your hearing is. It's called the whisper test. I'm going to come behind you and I'm just going to whisper a series of letters and numbers.
1B6. 2C4.
Okay, very good. Well, Amanda, this concludes my assessment of your neurologic and your musculoskeletal system. Do you have any questions?
No.
Okay, thank you very much.